All right, so our next speaker is Associate Professor Lesley Stafford, who is speaking about mental health and breast cancer. Lesley is the head of clinical psychology at the Royal Women's Hospital in Melbourne and is a clinical psychologist who works predominantly with women diagnosed with breast cancer and women considered at high risk of developing breast or ovarian cancer. Hi, Lesley.
Hi, good evening, Anna, and thank you for the opportunity to join you this evening to discuss this very important topic of mental health and breast cancer. So I plan to cover quite a bit of material in my 12 minutes, but if there's one sort of take-home message from my presentation, I'd like that to be that maintaining and promoting mental health in the context of breast cancer should not be considered a luxury add-on. Instead, it's an integral component of your treatment and of your quality of life. And certainly, Breast Cancer Trials is very interested in the supportive care or the psychological component of breast cancer. And the trials that Prue spoke about earlier, testing different treatments for cancers, many of those will include a significant component that focuses on the psychological and quality of life aspects from the patient's perspective. So if you are struggling with your mental health, please know that you are not alone. About 4 in 10 women will have significant distress of some description following a diagnosis of breast cancer. And distress is often in the form of symptoms of depression or anxiety or fear of recurrence or progression. Sometimes it's insomnia or sexual dysfunction, but certainly the list I have on the slide is by no means exhaustive. Often those symptoms are worse shortly after diagnosis, and sometimes during intensive treatment they can escalate, but we do also know, unfortunately, that symptoms can persist for years after diagnosis and completion of treatment. At the same time though, it's important for you to realise that just because it's not uncommon to experience distress or to experience the sorts of symptoms that I've listed here, that's not the same as saying that these symptoms or these concerns don't need to be addressed. They most certainly do need to be addressed. We know, of course, that breast cancer diagnosis and treatment occurs amidst living of a busy life, occurs amongst women who are mothers, who are partners, who are carers, who have jobs, with all sorts of responsibilities. And these responsibilities don't simply cease now because you are sick. And so that disruption can be quite substantial. So generally speaking, I see this disruption as manifesting in sort of 2 broad themes. One that involves a sense of loss and grief, and the other that centres around fear or worry. So if you have a look at my diagrams, you'll see that women can experience multiple different losses to varying degrees. There are often very tangible losses like losing a breast or losing your hair or losing income. And then there are those losses that are less tangible, like loss of identity or loss of role, loss of certainty and control. And sometimes it's these themes of loss of opportunity that feed into the symptoms of depression. The other theme that comes up a lot in my clinic is obviously fear and worry. Now, some of these worries are based on events that are currently happening, but usually they're very future focused and take the what if form. So what if my cancer comes back or progresses? What if I can't stand the pain associated with a certain treatment? And often a major worry is the impact on caregiving of our dependents, particularly young children, and their children's emotional health, and generally how we fulfill our parental roles. This is actually a bit of an area of special interest of mine, so I'd like to take this opportunity to reassure you that the vast majority of children do not experience long-term consequences as a result of maternal breast cancer, and most adjust quite well. I also want to let you know that the picture is not all doom and gloom. My experience and quite a bit of the research data now shows that women can also feel benefit or grow psychologically or spiritually from their experience of breast cancer. So women will report more regard for life's value and even a new sense of vulnerability to death. They often, in terms of new life experiences, will change their priorities and make different life choices. Sometimes feelings of closeness can improve, relationships with friends and family. Often there's a newfound interest in spiritual development or religion, and what we do see quite regularly is an increased sense of mental strength and a sense of empowerment. So I'm often asked in a clinic, how much is too much anxiety? The normal anxiety, I think we all know, is feeling stressed or worried when we're under pressure, and there's certainly plenty of that to go around when you're diagnosed with cancer. But in normal worry, normal anxiety, that feeling passes, and your thoughts and feelings and behaviours don't have a significant impact on your day-to-day life. When you need to think about seeking support is when that worry becomes difficult to control or becomes intrusive, and you potentially have episodes of intense fear or ongoing upsetting dreams where you find that you're having difficulty making decisions or managing social situations, or perhaps where you find that you're using alcohol and drugs to manage your feelings. So along a similar vein, I'm sometimes asked about how much sadness is normal and when does sadness become depression. And again, it's quite normal for all of us to have ups and downs and to feel irritable or sad or angry or frustrated, so long as those thoughts and feelings don't have a significant impact on our day-to-day lives. When it's really important to seek mental health support is when those feelings of sadness are intense or enduring, that you're feeling miserable most of the time for more than a couple of weeks. Another key issue to watch out for is losing interest or not being able to take pleasure in your usual activities. Now, of course, I recognise, speaking from lockdown Melbourne, that there may not be as many activities that you can participate in if you are unwell, and especially so during COVID. But the key thing to think about is whether you still have the capacity to experience pleasure and have fun if you had that opportunity. So other key signs I'd invite you to watch for are withdrawing from your close friends and family, feeling constantly overwhelmed or indecisive, feeling that you can't actually manage your feelings. If you have any thoughts like, I'm a failure, life is not worth living, or if you feel worthless or hopeless, or think that you might harm yourself, those are clear signs that you do need more support. So why does it all matter? What's the big fuss about mental health? Well, the fuss is that depression in particular has quite serious implications if it's untreated. And untreated depression is associated with higher rates of death. People with depression are about 3 times less likely to stick to their treatment plans. They tend to stay in hospital for longer. They can experience their physical symptoms more severely. And so there's a substantial impact on quality of life. And perhaps, for me as a psychologist, is that the idea that depression really interferes with our ability to make meaning out of our experience. And without meaning in the context of suffering that does accompany cancer, it is quite difficult to have hope. So this slide is about some of the myths and facts about mental illness that I often hear. One is that depression is a weakness, and that if you're using antidepressant medication, it's likely to be addictive or change your personality. And look, depression is an illness which can require medication, and medication requires medical supervision just like other illnesses. Certainly it does not change your personality, and it is not addictive. And depression and anxiety treatments are in fact very effective and available from a range of resources. And I have some resources on a couple of my slides which will be made available to you, as I understand. I also often hear that seeking help is a sign of weakness, or if it's not stated, it's implied. But it's not. Seeking help is actually a sign of strength and adaptation. And finally, as I said before, many think that taking care of your mental health is a luxury or an optional bonus in the context of a cancer diagnosis. But it's not. It is actually integral to your recovery and to quality of life. So if you do think you need support from a professional, you have a few options. Your hospital treatment team is always a good place to start, and they can often make referrals and suggestions if they do have a specialist social worker, psychologist, counsellor or psychiatrist available on site. And many places don't have those resources, but it's certainly a good place to start for information and practical advice. Within the community, your GP should be your first point of contact. GPs can assess your concerns, discuss the treatments, and they then make the referrals to the appropriate mental health clinicians. Some GPs can actually provide brief psychological therapy, and of course they do prescribe medication and manage antidepressant medication on a regular basis. Your GP can give you a referral to see a psychologist or a clinical psychologist in the community under what's called a mental health care plan. Now, a mental health care plan recently has been changed to provide you with 20 Medicare rebatable sessions in a calendar year. And if you have private health insurance, you don't even need a GP referral to see a counsellor. Telehealth has become an increasingly used option and very much the new normal in COVID, so that actually makes care much more accessible under Medicare. And I have listed a couple of sites here where you can find a psychologist in your local area or one that will provide telehealth. Your GP can also refer you to a psychiatrist if needed. I've listed here a handful of community-based resources because the reality is most people don't need formal mental health support. Lots of people are fine to self-manage and talk to friends. Some will benefit from support groups or counselling with the primary team. But I would encourage you to go online and investigate the quite extensive information and resources that are available to you in the community. So we're running out of time. I've just got a couple of slides left. I wanted to say here is that when I think about psychological adaptation to breast cancer, I think about a woman moving from a situation in which she might feel like breast cancer has taken over her entire life, her identity, her every waking thought, to shifting to a situation where she's able to make space within herself for that diagnosis, for the treatment, for its prognosis, so that it no longer defines her or controls her. And this is certainly what I like to work on with my patients. And I know it seems very easy to say and it's not as easy to do, but it certainly is possible. So I want to leave you with some final thoughts about promoting and maintaining your mental health. First of all, speak up. Don't say that you are fine when you're not. Even the best oncologist, the best breast care nurse is not a very good mind reader. The second thing is accept help if it's offered. Next time someone says, can I help you in some way? Say yes, you can. And think of a practical task that the person can do for you. Third, be informed. There's a lot of information out there, but be judicious about the source of your information. Fourth, and others have talked about this, exercise. You don't have to train for a marathon, but get moving. It's a well-established source of good mental and physical health. Now for some psychobabble. Practice self-compassion. And by self-compassion, I mean treat yourself as you would your best friend. This means being warm and understanding towards yourself when you are suffering or when you feel you're inadequate, rather than ignoring your pain or beating yourself up about your failures. When we show ourselves self-compassion, we recognize that suffering is part of a shared human experience, rather than something that we go through alone or something that happens to you alone. Self-compassion also involves a sort of a mindful awareness of our thoughts and feelings so that we can observe them for what they are without denying them or suppressing them. So the reason this is about self-compassion is because you can't ignore your pain and feel compassion for yourself at the same time. And this is certainly a skill that can be taught. Another part of good mental health that goes with self-compassion is acceptance. And what I mean here is not resignation or self-defeat that implies something being done to you, but what I mean is that accepting certain painful feelings and thoughts and symptoms without trying to struggle against them. I encourage you to have goals, but they need to be realistic and achievable, and you need to pace yourself. And I'd invite you to focus on the things that you can control and let go of the rest. Finally, practice gratitude. There's quite a big evidence base now to show that there are benefits for mental health. If you have a diagnosis of cancer, or you're receiving treatment, or you're living with metastatic disease, you may feel that you don't have very much for which to be grateful. But certainly if you think about those aspects of your life that are a source of joy for you, and that could be healthy children, or a loving partner, or even something like the privilege of living in a first world country with good treatment, consider what it might be like not to have those things in your life. So I think that's it for me. I wish you all the very best in these very trying times.
Thank you, Lesley. That was fantastic. And I loved your message at the very beginning when you said, you're not alone. That was very powerful. Now, in terms of questions, the most common question we're receiving, Lesley, is are we going to make the information that you presented and all the resources that are available available to everyone who's watching? So the very simple answer is yes, we are. So we're recording this event, and hopefully tomorrow we'll send a link to everyone who has registered with a link to the actual presentations themselves. So you'll receive all the information that you've just heard in Lesley's presentation. So thank you, Lesley. It's greatly appreciated.